Hi there, good evening. How is everybody? It's very nice to be with you. It's Dr. Sabine here with Canelli, her health coach. I'm this holistic obstetrician and gynecologist. I've been practicing, the magic of hormones for more than 30 years, and it's really something that fascinates me every day in a new way and shape because ladies, let's face it, we are our hormones and really, I wanted to share with you today and really discuss a little bit and give you my hindsight because these are the stories that I basically hear every day. These are the stories that we experience, I experience, Canelli, you experience. I mean, it's not something that only you experience, it's something that we all experience. So don't feel bad. And it's really this very stubborn weight that you cannot shed. And, obviously, from my perspective as a gynecologist and being very involved with the endocrinology of gynecology, which means all the hormones that are being produced and are being really responsible for so many functions in our body, I would like to discuss and guide you a little bit on the the issue of weight loss and hormones, and we're really asking the question. And good evening, Candeli, it's really nice to see you with your beautiful colors and your smile. I'm always happy to see you indeed. And really, I mean, we really see also that in our programs that we run, that I would say that the majority, as an intention or an incentive, they really want to lose weight, and then as a result of balancing their hormones in our programs, they really see that they feel so much better, that their hair is better, their skin is better, their sleep is better, their sex is better. So yes, we're talking about the weight loss because that is obviously what annoys us when we don't fit into our clothes or if the size has gone up one or two or three numbers. But this is just the tip of the iceberg that you see here with your size of your clothes. It's really much more to it. So we want to ask you this question, where we have our first slide and really dive right into it with you in this little webinar and really ask, are the hormones the cause of your weight issue? That's really the question here. And to be honest, many times it is, and many occasions it needs really a little bit of balancing and a little bit of tweaking and trying to get your hormones again in a balanced state and not in an unbalanced state. So we want to really run you through this kind of hormone issue weight loss webinar because I would like you to be educated to be able to recognize for you if that is the case so that you know where to go and that you know where you need to look for. Because, where are you experiencing, unexplained weight gain or stubborn belly fat or resistant weight that even though, you're doing everything right, your scale doesn't budge. How do you say it?
Doesn't budge,
Doesn't
yeah.
move,
Hmm.
doesn't budge. Are you eating and doing everything you did before, and you always had this amount of food, and you're still putting on weight? Have you tried all different diets, keto diets, carnivore, intermittent fasting, calorie reduction, and nothing moves? I mean, we're all experiencing that. Are you experiencing it? Are you addressing, I want you to be able to address the root cause of this thing happening in your body to understand the primary reason for the weight gain. And that is so important. Hormones are the chemical messengers in our body. And if you look here at this little, at this little slide where it really shows all these different organs that are producing hormones. I mean, it's just an amazing miracle and miraculous way of interaction that they really, go and work through our body like little messages. It starts from the hypothalamus, from the pituitary gland, from the pineal gland, from the thyroid, from the parathyroid, also very important little gland next to the thyroid, from the thymus, which is an organ that is very prominent in the in the child's age, and slowly starts retracting and reclining in function and size when you grow older. You have the pancreas, you have the adrenal gland, and we have the ovaries and the testicles. So it's really a very, very complex system. And you can imagine that if anything in this kind of departments are not working with each other, because we're supposed to work like a symphony orchestra, that everything works together and everything is really in harmony. And if it doesn't, then one department really blocks the other, and it's a downward spiral, which very often ends up with extra fat, but it's also a lot of not feeling well and being constantly tired, etc. So we're going to go and look at all these hormones, and there are quite a few hormones, 7 hormones that can affect your weight, and I would like to go through them with you. So one is the cortisol, which is the primary stress hormone. Remember the fight and flight. So we're designed to go on a war or on a hunt, or we're running away from the tiger. So we are really designed for this short-term stress and for the sprint of stress, and not for the prolonged stress that really takes off the rhythm of your cortisol rhythm totally. So cortisol levels are high when they should be low, and they're low when they should be high, or they're chronically high, or they're consistently low. The balance is due to communication disruptions between your brain and your adrenal glands. And of course, not only the communication that is disrupted, but it's really our lifestyle, the way we live, that we're constantly really having to do jobs, to run errands, to look after our partners, our children, our work colleagues, our work tasks. I mean, it's like a constant, chronic stress that we are going. And actually, the fact that we're doing at night now a webinar is also, in a way, a little bit of a stress situation. As much as I enjoy it, and we always love being with you, it's also something that definitely doesn't allow my melatonin to come up and slowly get me into the sleepy mood. But I'm just telling you, the this is
The digital age, that we
the
always on
digital
our
age. Always.
devices, the blue light is always waking us up, it's disrupting, it's again telling you, like, it's a stress response. The ting, the beep on your phone when you trying to relax, or the fact that somebody phones you and you're trying to relax. So the body never gets this rhythm of, like, and we always have to answer messages, especially women. Women have to answer all their emails and all their messages before they go to bed. We have to be very responsive immediately, whereas men don't really do that. And sometimes we can learn from men as well. It's like, it's okay if you get back to somebody a couple of days late. What's going to happen? Nothing.
But for sure, the imbalance in the cortisol levels, either too high or too low, is definitely causing a lot of weight gain. And it's causing, we have the slide also with the symptoms, what cortisol symptoms to look for. And I mean, it's really endless. I mean, we just put the big ones out there, but there are so many more. So it's definitely the trouble of losing weight, and you trouble staying asleep at night, so your sleep is very shallow. You wake up all the time, you cannot go back to sleep. You're tired but wired. You have blood sugar problems because cortisol and sugar is directly connected. You have dizziness after standing up too quickly. You have very low sex drive. You can't be bothered to have sex. You rather want to sleep and get some rest and having sex. So it's really losing its perspective. You can be moody, you have a fatigue in the afternoon, and then, you know, like you want to really almost fall asleep, and you're praying for your pillow at 3 or 4 o'clock in the afternoon, where you're still on your desk and you supposedly have to work. You're craving salty or sugary food, so you have this, you know, craving attacks that you cannot control. You have the headaches in the afternoon. You have get trouble getting up in the morning and get started. You have very weak nails and brittle hair. You might have chronic inflammation, irregular cycles, skipping cycles. So there's a lot of cortisol effects onto the gynecological, you know, cycle regularity. I mean, there's a lot of times that when girls are in their final years of exams, either in the, you know, A levels or the IB or Panhellenius in Greek, you know, there's so many girls that they don't have a period because they're so stressed. So, and it doesn't mean that they go into menopause. So cortisol is really a big one, and it's a very subtle one that we often do not realize, and that's why it's very important that we're here together tonight to really point out what this can present. Also, a big one is the thyroid hormone. The thyroid gland regulates the metabolism. It produces hormones to increase cellular activity and metabolism. And if your thyroid is underactive, your cells don't get enough thyroid hormone, which serially dials down your metabolism, leading to weight gain. So it's really, that's probably the most common um, hormone known for, you know, to be responsible for weight gain. And you might, you know, your symptoms might be that you have constipation, that you have excessive hair loss or thinning. You very often, you have also the thinning of the outer third of the eyebrow, very specifically. You need extra sleep to function properly. You have very rapid weight gain, feeling tired, morning headaches that subside as the days go on, dry skin, cold feet, hands, and cold all over, brain fog, and you're very often constipated and depressed, and you lack motivation. So this is just to give you a little taste of a hormone imbalance if the thyroid is involved. And here's, of course, the big one are the estrogens. The estrogens are three main components. One is the estrone, which is the E1, the estradiol, the most commonly known E2, and the estriol E3, which is the hormone that is very high when we're pregnant. So the ratio of these three components of the estrogen is extremely important for men and women. And having too much estrogen in the body causes many symptoms, and one of it is definitely the weight gain and moodiness and PMS and you know, very various psychological functions. So if your symptoms of low estrogen would be depression, night sweats, you wake up, you're all drenched, hot flushes, you have recurrent bladder infections, UTIs, you're brain fogged, you're fatigued, vaginal dryness, so really, you know, sex really doesn't become any pleasure. So this is really when your estrogen is low, and that's something that is very much involved in the perimenopause and the menopause. So this is really something that we see a lot. And then also, of course, in that phase, women put on a lot of weight and they cannot get rid of it. And symptoms to look for high estrogen is you feel extremely bloated. You have breast tenderness. You feel that your breasts cannot be touched. Even the bra is difficult. Mood swings, insomnia, depression, brain fog. Very often also abnormal pap smear, migraines, headaches, gallbladder problems, anxiety, mood swings, and so on and so on. So it's really a very big list of of something that I see every day, ladies. I mean, it's really not something that I read in the book and I've never heard of it again. I mean, it's really every day. You know, so many women that they suddenly cannot drive the car anymore, or they're afraid of heights, or they cannot get in a plane, or they feel that, you know, any kind of extra targets that gets put to them at work really makes them faint because they feel they cannot deal with it. So it's really something that a lot of women suffer and get exposed to, and unfortunately nobody talks about it, and that's why we're here, right, Cornelia? I mean, this taboo regarding all these symptoms is really, it's enough. I mean, women should speak up. They should be, you know, they should be vocal and verbal about it, and don't feel that they do something wrong or that they are to blame, etc. Now, there's progesterone, which is the second phase cycle hormone of the female cycle. So progesterone is very important for the normal function of both male and female bodies. Progesterone is the feel-good hormone that balances and buffers the effects of estrogen. So they're like a dance partner. The estrogen and the progesterone, they should always dance together, either samba or cha-cha-cha or tango. So they need to be in harmony. So if one is significantly more or less, it really will affect the hormonal dance. So without enough progesterone, estrogen's level will get out of control, leading to estrogen dominance, which is also something that I see every day. And as a result, women can experience increased belly fat and fat around the hips and thighs, sometimes very suddenly over the course of just a few months and weeks, I would even say. So and in the aging process of women, and especially if it's combined with stress, the first hormone that really goes down the drain is progesterone. So a lot of women then go into the estrogen dominance, which means it's excessive estrogen levels. And let me tell you that, you know, you feel all these symptoms of estrogen dominance like we saw before, but the blood tests seem normal. And this is always what is so frustrating for women. And they, you know, they have gone to so many gynecologists and endocrinologists and really telling them, begging them, they feel horrible, they're not themselves anymore. But because the level of estrogen is in the normal range, they're just, you know, they're just not acknowledged. And they say, you know, everything is fine with you, you need to go and see a shrink. But what is really the most important aspect of interpreting hormones is really the relation between them. So the relation of estrogen with progesterone, the relation with progesterone and cortisol, the relation with, you know, thyroid and progesterone. So they're all intertangled all the time, and you cannot really just look for normal levels and then, you know, just not acknowledge the woman in her anxiety and her insomnia and her PMS and her heavy blood flow, cyclical headaches, infertility, breast tenderness, stubborn weight gain. I mean, these are all signs that there's an imbalance and that there's an hormonal reason underlying. And this is really something that should be taken serious, because the woman is not the doctor. She's not there to find a solution. The woman is going and seeking advice because she feels that there's something wrong with her. Right, Canelli? I mean, this is what we see so often. Mm? Now, a very big one that gets very often underlooked. Of course, testosterone is the male hormone, and we always get associated with man testosterone, and not many women really have in their mind and in their awareness that testosterone is also a hormone that's very important for women. And testosterone imbalance becomes to be more and more common in modern women. And typically it's high testosterone in younger women and low testosterone in women over 40. Several studies have linked testosterone to low sex drive, heart disease, and even breast cancer in women. For women, both too low or too high testosterone leads to an inability to lose weight and or gain weight. So this is a very big player. And if we look at the symptoms that we look out for when there's an imbalance of testosterone, especially when it's high testosterone, you really have acne, you have very oily skin. You might have polycystic ovarian syndrome because the ovaries produce extra testosterone. You might have thinning of hair, that you feel that your hair is really not so much falling, but it's thinning, and very often also on the central part of the head, you lose the hair. You might have mid-cycle pain and cramping. You have excessive hair on the face and on the arms. You might have hypoglycemia, so very low sugar levels, or unstable sugar level, ovarian cyst, weight imbalance. So it's all there. And low testosterone is really very complicated, and it's extremely responsible for the inability to lose weight and obviously also to gain weight. A very interesting hormone, which has not really gained a lot of attention, and one of the reasons probably that there's no drug that can be prescribed in order to balance the leptin. And the leptin is really the hormone. Leptin and ghrelin are the hormones that they are responsible for the fat distribution. Um, did you know that the fat cells in your body are part of your endocrine system? Yeah, that's right. They are not just nuisances that make your clothes not fit. Fat cells oversee the production of the hormone leptin. Leptin is the fullness hormone that works by telling your brain when you're full, and sometimes, though, your body stops recognizing the leptin. We call this leptin resistance, which makes your brain think that too little leptin is being produced. So it's always interesting and worth it to measure your leptin, because if you have leptin resistance, then there are certain measures that can be taken in order to stabilize it and bring it back to normal. So it's very interesting to look into leptin. Um, um, which the body interprets as fat reserves must be low and you must be starving. Do you want to say something to that, Kaneli?
Yeah, I mean, I think I've said this in a previous, many years ago, when I was in the state, right? So I took a trip to New York. I didn't sleep on the aeroplane, and when I got there, because I had the sleep deprivation,
Mm.
my body, in the morning I woke up, I had yogurt with, I had coconut yogurt with berries, and then I went on a brief little run, and then I sat down at a little cafe and I had salmon on rye bread with a matcha latte, and I had avocado, and I think I had even egg. And when I got to my conference, my body still said it's hungry, and I had to go down and find bananas and nuts. So this was crazy to eat all of that in the morning because, the lack of sleep, right, which we say also disrupts everything, and then the leptin wasn't working properly. So it's really you mentioned something, Dr. Sabine, before about the fat cells, and we also have hormone receptors, right? We have estrogen receptors all over the body. And this is an
Mm.
interesting topic that kind of, women also discover that they start losing the belly fat. And when your fat is high and your estrogen is high, then your testosterone is also going to be high, so it's all like quite a dance.
No. And the other thing is that if you don't do the right way of exercise, and because in this hormonal imbalance we definitely lose muscle volume, the fat really goes to the belly. So it's very important that you also combine the right way of exercising and feeding the muscles so that the fat cells that can be distributed where they belong and not just make an overstorage and cause this horrible belly fat that everybody feels very stressed
So yeah,
about. So
we're definitely encouraging women to go into the gym and to do weights and to do strength training, but definitely to eat before. Don't go on a fasting state. Don't go
mm,
when you're doing your intermittent fasting. Go into a state that you've eaten definitely some protein before you go to the gym, because your body's going to use up all of that energy immediately. So you don't want to be creating more stress. So if you go into the gym in a starving state, your body's going to say, "Hey, stress, raise the cortisol," which is going to be completely
counterproductive.
yeah, putting on the belly fat to protect you.
Mm, absolutely. Like leptin resistance that we said earlier, we also have the insulin resistance, and that's a hormonal resistance pattern and not a hormonal deficiency issue. So insulin resistance has been linked to obesity as well as other health problems. Unfortunately, most people only recognize insulin resistance when it becomes type 2 diabetes, but it's been around for many, many, many months, if not years. And it's always really worth it to look into your insulin levels and the long-term sugar levels, HbA1c, and however the insulin um, resistance can also occur in people who have subclinical blood sugar imbalance. So it's a very important player because it really allows the uptake of sugar in your cells and how it's going to be stored, etc. So insulin resistance is something that we always look into in the practice because it's one of the big endocrine players. And obviously, if the sugar cannot be taken into the cell, then it's going to be stored as fat. So even non, of course, not type 2 diabetes, but even sort of pre-diabetes is a very big factor in many women, and they very often don't they go undiagnosed, and then it's almost impossible to lose a gram with all the effort that many women do.
Yeah, and the thing is, this is something that we want to control sooner than later, because later there's other problems. There's so many studies now that have also identified the link between insulin resistance and dementias and Alzheimer's. And so, if your traditional, doctor is not going to necessarily tell you to go and look at your insulin levels and your the way that your insulin is converting long term, and it should always just be that H1 should be under 5, and yet your normal, I mean, speaking to the normal, like what doctors call the normal levels, but that's often patients say, well, my levels are normal, just because you've got 5.5, 5.7, you know um, and like you had pointed out to me many years ago, Dr. Sabine, that you were going, no, that your fasting blood sugar should not be 100 or 105 or 110, even though the level is okay, it's still, telling you about the picture of the patient.
Absolutely. So it's and this is also what I find sometimes frustrating, that people are lingering for years in this kind of high range of normal, which could have been an alarming move long time ago to really make changes, and they only get advice because that's how the medical world works. They only get advice that there's something brewing and something preparing to become the direction of a disease when it's then for years been around. So be a little bit more alert when you look at your blood levels and your results, and make sure that you're optimized and not just acceptable. I mean, symptoms that we want to look for that really in give us the hint that there might be a hormonal component behind your struggle to lose weight or constantly put on weight is blurred vision, dependence on coffee, fatigue after meals. So there are a lot of people that they eat, and then an hour later they need to really
Go
lie
lie
down on their
down.
pillow. Yeah, I mean, it's crazy how many people
Yeah.
do that. A lot of people are really angry when they miss a meal, or they're shaky or jittery, or they have tremors, and they have sugar cravings. I cannot do otherwise. I need to eat a jar of ice cream in the middle of the night. I mean, they think it's funny. I mean, this is obviously, this is definitely insulin and blood sugar playing their games, and sugar cravings and increased thirst or appetite, memory issues, and you're feeling unusually irritated. And, many people say, I feel I'm not myself. So these are all, indications that you just say, oops, maybe I should see my healthcare provider and check my hormones. That's definitely, an important thought. It's food for thought for you, so that you can actually, understand in which direction you're going, and what are the causes for hormonal imbalance. I mean, probably if we go into this, we can probably stay here until the day after tomorrow. But um, I would say a lot of medications also cause, hormonal imbalance, and people are not really aware. One big one is really antidepressants, the SSRIs, the blood pressure medication, birth control, exposure to toxin, immune dysregulation, inflammation, the methylation impairments, mold exposure, nutrient deficiency, poor diet, too much sugar and caffeine, poor sleep, prolonged stress, reproductive system disorders as endometriosis or PCOS, menopause, sedentary lifestyle, intrauterine devices. I mean, and so on and so on. So there are a lot of subtle things that they look like this beautiful tree here, that they're really working underground until the asphalt breaks and the roots come through. But if you experience these things, and you have you're in that position that you're exposed to many of these root causes, it's important to really
And it's
look a little
interesting
deeper.
because, it could be subtle. Like, for example, you're getting migraines, so you're going to take either a paracetamol, or you're going to take, some anti-inflammatory drug, and that's going to disrupt your gut lining. And then we know that we've also got hormone receptors in the gut. So, it kind of like, these are little things, but even the sedentary lifestyle, like sitting and not walking enough, and it's a complete disruptor. So there's been a lot more, work from home or work digitally, or etc., etc. So these are, I mean, we saw it in the pandemic, right? When people are sitting more, not moving enough, weren't allowed to move, and it was just, we kind of still living through the after effects of all of that. And then the
Mhm.
methylation, Dr. Sabine, that you mentioned here, I mean, it's like, how are your detox pathways? How are they able to actually get rid of, if you're piling in many things and you're drinking coffee, and we've spoken about this when we speak about, you can watch any of our trainings with liver detoxes and estrogen dominance to understand that. So, you know, what we kind of like to do is we like to work with root cause to understand, hang on, what's actually happening? How can we help the body to let go of a lot of these disruptions? And Dr. Sabine, I love that there's a month course, because okay, it is bikini season now, and we've got it running now in the summer. Why? Because you can actually use the hot weather as a push, right? We can do lots more being in the sea. It all helps with weight loss. So if we just know how to turn these good genes on and turn the hormones on, then it can work for us. So we're going to run this for about a month. You're going to get yourselves into the course, You're going to get a hormone and weight loss program. We're going to talk about all those symptoms. We'll give you a list so that you know exactly what to go get tested on, or if you are a patient of Dr. Sabine's, then let's get retested. You're going to have weekly meal plans and recipe books that are going to come at you every week, so that you know what to go and shop for, you know what to cook. We're going to take away some of the disruptors that are going to cause inflammation. And every week you're going to come onto a call like this and onto Zoom, and we are going to support you with getting some of these habits to stick. And of course, Rome wasn't built in a day, and so you're going to get into a momentum, and then the body kind of knows what to do. And then we're also going to tell you what to do when you do lose track. What sort of exercise should you be doing? What's a little bit more stressful than, especially when you get 40 plus, right? So if you're 20, 30, hopefully you don't have these issues. But once you get to 40, 50, then maybe the 20-kilometer run is not the right thing for you. So we're going to give you some support in that. You can go to drsabine.com/weight loss, and you can see all the details of the program. We'd love to have you join us. And that's my invite to everybody. Don't wait to feel better before you feel better, right? Because you want to make, as Dr. Sabine always says, make the choices now. Because I tell you what, we see it as the years go by, it becomes more difficult and more difficult, and your metabolism slows down. So you want to do it now.
Absolutely. And really, be stronger than your own excuses, because that is really, that's the trend is really that you're tired, you want to just sit on the sofa, order a pizza, and not move, not think about cooking, etc., etc. But it's the body becomes less and less forgiving, and the pounds and the kilos, they just add up. And it's nice to be in a group and be guided by us, that we have so much experience with this, and we've seen it all, and we've seen it work, and we've seen all these ladies flourishing and being just so much happier and healthier. And as a side effect, you actually lose the weight. I mean, it's really something that is the most rewarding thing, really, in my work, that doing these courses, we give you the tools to do it, and you can be your best master chef, and at the same time really you know bring your health up to a different level, and that is really very special. So we hope to see you soon. Thank you very much for joining us, and I hope that this was informative and interesting for you, and we'll meet again in our next lives and
Yeah, and, and,
webinars.
and also maybe some of those symptoms, ladies, they're not in your head, that it's actually real. You are feeling this, and we just want to affirm that, because sometimes maybe you had a blood test and it said normal, but we just want to affirm that those are the symptoms that you could be experiencing, even if your blood test comes back normal, right, Dr. Sabine? So
Absolutely, don't let you be fooled. Your body is your best friend and your best mirror. So if you see that things are going in the wrong direction, so you just pick up this little course, reset your new normal, and off you go. Thank you very much for joining. Thank you, Canelli, for being here with us, and I'll see you soon. Be well. Thank you. Bye. Bye.